Rhinoplasty is applied for appearance for nasal arch, dropping nose, correction of angle between nose and forehead, or between nose and lips, deformities such as nasal width, nasal fractures, nasal enlargement, nasal reduction, or asymmetrical problems of the nose. Aesthetics for the nose can be applied not only for aesthetics appearance, but also for problems such as non-nasal conch, sinusitis, or deviation of the airways. Nose surgery can be performed on patients with aesthetic problems, functional disorder, as well as aesthetic disorders and functional problems. Although rhinoplasty surgery is performed very frequently, it is not preferred among teenagers who have not completed their development. Even if the surgery is carried out at a young age for nasal function disorders, it is preferable to wait until the age of 18 for surgeries carried out for cosmetic purposes. Cosmetic nose surgery can be done in different ways depending on the procedure required by the patient. Doctors can choose one of closed nose surgery, open nose surgery, endoscopic, dynamic 3D, and padless surgery. Open and closed rhinoplasty is the preferred methods of doctors. Closed rhinoplasty is more preferred, especially if it involves procedures on the tip of the nose. Open rhinoplasty, on the other hand, is frequently applied to cartilage and asymmetrical disorders and usually leaves a slight scar. The non-surgical rhinoplasty operation is usually performed with a filler process. If the structure of the nose is also switchable, it is preferred for disorders of deformity or asymmetry of the nose. Before undergoing rhinoplasty, the doctor involved should be thorough research. A reference can be requested from the doctor for the technique to be used, the three-dimensional modeling, and previous interventions by making an appointment for a preliminary interview. Nasal tip aesthetics are favored in cases where the tip of the nose is wide, asymmetrical, low, or very raised. If there is no additional aesthetics reason for the nasal tip, the nasal bone is not involved. Rhinoplasty is one of the most preferred cosmetic operations in recent times, although nose aesthetics is now an easy operation that can be performed on the same day. There are certain situations that need to be considered after the operation. Patients are discharged 6-7 hours after nose surgery. Patients who have undergone rhinoplasty should be extremely careful with their diet, not smoke, and take precautions such as protecting their nose from blows. The recovery period for patients who have undergone nose surgery can vary from person to another. It can change within a week to 2 months after the nose operation. The complete adjustment of the aesthetic nose varies between 6 months and 1 year.